So good afternoon, everyone. Thank you for having me here today, and thank you to Lotus Caring Hands for putting on a great event. I certainly have learnt a huge amount, so I hope you all have too. So my name is Laksha. I'm a doctor who specialises in dermatology, so that's looking after diseases of the skin. And what I'd like to spend the next 10 minutes or so doing is talking you through my personal journey, obstacles and challenges that I've faced along the way, and lessons that I've learnt and how I would approach it now in hindsight, and hopefully you can take something useful away from that too. So in addition to being a dermatologist, I also have a big interest in medical education, so that's teaching medical undergraduate and postgraduate doctors. I'm the undergraduate lead for dermatology at Imperial College, School of Medicine, so that involves doing a lot of lecturing for the undergraduate medical students, putting together their exam papers for dermatology, and it's a real honour to be one of the first people to teach someone about the skin. I came to dermatology slightly later in life than most of my colleagues did. When I first qualified, I wasn't sure what I wanted to do as a doctor. I enjoyed a little bit of everything. I definitely enjoyed communicating with people, and I wanted some sort of a semblance of a work-life balance. So I thought that a career in general practice might offer that. So I did an academic training pathway in general practice, qualified, worked for a year as a GP, and it was only as a GP that I saw a lot of skin conditions, because it's not all that often that someone with a skin condition will present to A&E, for example. And that was a point at which I thought to myself, this is what I want to do. I was in my late 20s at the time, and I was sort of faced with a decision as to whether I continue working as a GP for the next sort of 40 years or so of my life, or whether I retrain. And I decided to do the latter and retrain and become a dermatologist, which was an additional 6 years of training. So I think hopefully what that demonstrates is that irrespective of the path you take in life, there's always a degree of flexibility. It's always okay to change your mind and try something different. And finally, in addition to sort of the teaching and clinical side of things, I also have a big interest in research, and in particular in medical education. So that's thinking about how can we train our medical students to be the best possible doctors? Is there something that we can do differently at university, which means that they will be more able clinicians and be able to deliver better patient care? Because that's ultimately what our career is all about. So I'm currently doing a PhD at Imperial looking at this and trying to create new methods of teaching and assessment for medical students, in particular on how to manage risk and uncertainty when they're faced with conundrums in the clinical practice world. So I'll take you back to where I started, which was sort of a similar age to all of you, I think, picking my GCSEs, picking my A-levels. And as some of my colleagues have already alluded to, it's undeniable that in the Tamil community, medicine might be a career that's often encouraged, and I think for good reason. It's an absolutely wonderful career, and if it's something that you would like to do, I'd highly, highly encourage you to pursue it. It has so much job satisfaction, and it's really rewarding. So even when you have a tough day, you can at least look back on your day and think, I made a difference to that person, and I think that always helps. For myself personally, I found myself leaning towards the science subjects more naturally. I found myself interested in how the human body works, what happens when it goes wrong, how one can fix it. But I also think it's important to be a good communicator. So, we're a patient-facing profession. You have to enjoy caring for people. It's a big part of what we do. And as one of the other panelists said, you could be, the smartest person in the room, but actually if you can't communicate with someone, if you don't have that ability to willingly care for someone, then it's going to be a tricky career to pursue. But I think it's very important that you go into it for the right reasons. So not because you're pressured to do so by anyone else, but because you genuinely think it might be something you can enjoy. And it's difficult to make that decision at the age of 16, in my personal experience, when you're picking your GCSEs. So things that I found helpful, because I didn't have any doctors in my immediate family, so what I ended up doing was reaching out to a bunch of different hospitals within London, contacting their human resources department, sending out letters, snail mail back in the day, to try and ask if there was any opportunity to do work experience. And I think I contacted over 30 hospitals, and only 4 of them came back to me to say, yes, you can do work experience with us. And I actually started doing work experience maybe a year ahead of most people, so it was in the summer of year 11 after my GCSEs. Only because I think if you want to pursue a career in medicine, it's quite important to be strategic about how you choose what activities that you do and what sort of things that they're looking for when you're applying for medical school. So I think making that decision slightly earlier on is quite helpful, because then you can sort of hone your path a bit more easily. So I would say the first thing is make sure you actually enjoy the subject matter, make sure you enjoy looking after people. Secondly, do some work experience, get some practical hands-on experience of what it's like to be a doctor. Talk to as many people as possible to find out what it's like being a doctor and to ensure it's the career for you. But even if you embark on a career in medicine and you get your degree, as I'll go on to describe, there are so many things that you can do with a medical degree. So, try not to put too much pressure on yourselves as to when you're making that decision early on in life. And then when it came to applying to medical school, one thing that I would think it's important to say, again, some of the other speakers have alluded to the fact that you can go to any institution, you can study medicine at any university, irrespective of whether it's Oxbridge or whether it's Imperial or UCL, and you will all graduate as doctors. You will all be on a level playing field when it comes to national applications for applying for the specialty of your choice, whether that's general practice, pediatrics, or dermatology. So I think when picking what medical school you'd like to go to, important considerations for me was, number one, do I want to stay in London? I've been born and raised in London, so I was quite keen to have an experience outside of London. Number two, do I know people who've gone to that university? Have they enjoyed it? What is it about that university that makes it special? What does it offer? Does that align with what I'm interested in? So I was quite scientific and research-minded, so I know that Cambridge was very good for that. And I know that Cambridge had linked with other universities, so through my affiliation with Cambridge, I was able to apply for an internship at Yale and do a summer of immunology research and things like that. So, but if you didn't enjoy sort of the hardcore science and you don't enjoy research as much, then maybe somewhere like Cambridge isn't the best place. So I think it's all about you as an individual. Where do you see yourself studying? It's 5 to 6 years of your life. Where do you see yourself spending that time? Does the experience at the university, does it resonate with you? And don't feel pressured to apply to a given place just because you think that's where you ought to apply. Go to the actual university, talk to people who've been there, spend a day there, see if you enjoy the environment, and then take it from there. Another lesson that I've learned that I wish I learned a little bit earlier on is it's just not about working hard, but it's about working smart. So be strategic. So by that I mean, if you think about what medical schools you'd like to apply for, do your research, have a look online, see what their entry requirements are, speak to people in the years above you at school, or if you don't know anyone, speak to a careers advisor at school if you have one and say, do you have a list of people that have applied for medicine? Am I able to contact them? And just contact them out of the blue and say, I'm really looking for some advice. I'd like to know how your experience was at being interviewed at this university, what sorts of things came up, what advice do you have for me on how I can prepare, because I'll be applying in a year or two. And that's really useful and helpful, I think. So spend your time wisely and invest your time in the activities that are going to be most fruitful when it comes to applying. And then once you're in medical school, they say that although it seems like an impossible task sometimes getting into medical school, once you're there, that's when the real hard work begins, is what I was told, and I think that holds true. So my advice for when you're navigating your time through medical school is, I think first and foremost, look after yourself. Medical school can be a competitive, intense environment, irrespective of where you study. And I think it's really easy to lose sight of that and just think about, oh my gosh, I need to pass my exam, or everyone else seems to be doing really well, and everyone else is so clever. But actually, you've got the capability to do as well as anyone else. It's just about keeping calm, looking after, as we've said before, your mental, your physical health, making sure you have a life outside of studying medicine, your hobbies, your societies, your friends. Those things are so important and will keep you going when times get tough, because they will inevitably get tough because it's a rigorous course, but it's 100% worth it. So I would always say, as we said, stay resilient, persevere, get through it, and when you're through on the other side, it's a fantastic career and it's really enjoyable. And finally, what I'd like to talk about is what can you do with a career in medicine once you've got your medical degree. If you want to be a hospital doctor or pursue the clinical route, you do your 2 foundation years where you rotate every 4 months in different specialties, and then that's a point at which you decide, do I want to be a GP, do I want to be a hospital surgeon, a hospital medical doctor, a paediatrician, etc. And that's when you go into your specialist training pathway. And as I said before, for me, I did GP first and then went back and retrained in dermatology, and I'm very, very happy to have made that decision. I enjoy being a dermatologist much more. But you also get the opportunity to do lots of other things, whether that's teaching, whether that's research, whether that's medical journalism, whether that's leaving clinical medicine altogether and doing pharmaceutical work, which a lot of my colleagues have done who've perhaps enjoyed working in a GP practice or in the hospital side of things a little less. So it's still a very useful degree to have, and it can send you in lots and lots of different places. You get to, once you've become established in your field, you get asked to go and speak at different conferences, you get to travel. But above all, it's a really meaningful and worthwhile career, because ultimately you're looking after people when they're in their most vulnerable, and that's a real kind of honour to be able to do. So I think key take-home messages that I have for you all. First of all, if you have any doubt as to whether you want to pursue a career in medicine, you will find some doctors who try to put you off. My personal feeling is absolutely yes, do it. It's a wonderful career, but make sure you're doing it for the right reasons. So not because you'll feel pressure to do so, but because it's something that you genuinely enjoy and want to do. Secondly, work smart as well as working hard. So be strategic, find out from other people what their experiences have been, and really plan ahead and start early with your preparation, because that will make the whole experience of applying to medical school less stressful for you, and even it will serve you well for your future time through medical school and beyond. And finally, when things get tough, as they will, particularly during medical school and your early years as a doctor, think about what motivates you. So for me, it's if you're treating a patient but you're really stressed and you're really busy, think about, okay, if that were a family member of mine, what would I want that doctor to be like? And try and be that person for your patient. Or if you're finding it really tough, think about what motivates you. So is it the sacrifices that other family members have made that have enabled you to be in a position to apply and study for medicine? And that's what motivated me. So overall, yeah, I think it's a wonderful career. I'd highly encourage you to do it. And please find me afterwards if you have any questions. Thanks very much.
It's always endearing when the soft landing is so comfortable. And you've been an amazing example of just that. One off-tangent question for you, okay? Given your steadfast clarity and conviction, the role of legal systems using AI and non-AI in the development of education in medical fraternity. How important is it? How muddled and gray is it? Because those are the kind of questions that the next generation will have to handle. Mm-hmm. The last many generations of traditional doctors have been very good, but the next generation of doctors need a kind of a paralegal approach to many sensitive sciences. What's your take on that?
Thank you. So I think AI plays a role not only in just kind of medical education, but also clinical delivery of services. So within dermatology, it's obviously a very visual specialty. So the area in which we've integrated AI the most is in skin cancer management. So when you see a GP with a mole that looks a little bit dodgy, it then gets referred to a dermatologist for further assessment. But the sheer volume of referrals that we're getting means that there's a big delay or we're not able to meet targets. So one of the hospitals in London where I've worked at previously have integrated this so that an AI machine will look at the images of the mole first to try and work out if it's harmful, not harmful, or they're not sure. And the harmful ones, we've now trained that AI to be confident enough to actually discharge those patients back to the GP without having seen a doctor. And that takes a lot of confidence, doesn't it? So, and medico-legally, it is a little tricky, because what happens if that goes wrong? Where does the legal responsibility lie? And that's where the hospitals have a lot of very clear contracts about where that responsibility lies. So I guess AI is very exciting things. We're very much embracing it within medicine, and that's where the direction of medicine is going. For medical education, so when we're putting our exam papers together, we actually run it through AI systems first. First of all, to see whether, during the pandemic, a lot of the medical students had remote assessments at the end of the year. So first of all, if an AI bot did the exam, would they get a passable mark or not? If you copy and pasted the exam question into Google, would you get an immediate response? And when we design and write exam questions, part of that process is actually making it complex and nuanced enough that that wouldn't be able to happen. But again, I think AI can be a very useful tool, particularly for summarizing, for giving you new ideas on how to approach a given subject. For example, if you're preparing for an examination, it should be something that we embrace, but with a little bit of caution, because it's not yet perfect by any means.
Thank you so much.
Thank you
That's
very
been
much.
really, really delightful.